Your cholesterol number came back normal, or within an acceptable range, and you left that appointment with a sense of reassurance that is entirely understandable, because cholesterol control is the framework most cardiovascular risk management is built around, and a normal number feels like a green light. But the biology of arterial disease is more complex than a single marker suggests, and the person whose cholesterol is well managed, but whose arteries are under chronic oxidative stress, producing inadequate nitric oxide, and carrying a smoldering inflammatory burden in the vessel wall, is not as protected as the normal number implies. I want to talk today about the full picture of arterial health, and specifically about 5 natural compounds whose evidence for supporting vascular function is grounded in specific, documented mechanisms, and about a simple morning drink that combines them in a way that most people can prepare in under 3 minutes. Before anything else, what I share in this video is educational information only. It is not medical advice. Dietary approaches support vascular health, and they do not substitute for medications prescribed to manage cardiovascular risk. If you have existing heart disease, are on blood thinners, or have any cardiovascular diagnosis, please discuss any dietary changes, including the addition of concentrated garlic or ginger, with your healthcare provider before making them. Both garlic and ginger have mild antiplatelet effects that, while beneficial in most people, require specific consideration in those on anticoagulant therapy. What I want to give you today is the mechanistic evidence behind these compounds so that your discussion with your doctor is an informed one. I am Dr. Andrew Carter, and I have spent 15 years working exclusively with adults over 60. The vascular health framework I am going to describe today connects to everything we have discussed on this channel about nitric oxide, endothelial function, inflammation, and oxidative stress. The morning drink protocol is not magic. It is a targeted nutritional input into specific physiological pathways, and the evidence behind each ingredient is the reason it belongs in those pathways. If this is your first time on this channel, subscribe right now because every week I bring you specific, grounded information about what your body needs after 60, and this video synthesizes the vascular support evidence we have built across multiple previous videos into a single practical daily habit. Let me start with the arterial health picture that this morning drink is designed to support, because the mechanism behind each ingredient is the reason for including it. Arterial plaque, the accumulation of oxidized LDL cholesterol, inflammatory cells, smooth muscle cells, and calcium within the arterial wall that over time narrows the channel available for blood flow, does not develop primarily because cholesterol is present in the blood. LDL cholesterol is present in the blood of all adults and serves important functions in cell membrane maintenance and steroid hormone production. Arterial plaque develops when LDL cholesterol enters the arterial wall through a damaged endothelial lining, where it becomes oxidized by the reactive oxygen species present in an inflamed, oxidatively stressed vascular environment. The 3 conditions most required for plaque development are endothelial dysfunction, meaning the arterial lining has lost its barrier integrity and its ability to regulate what crosses into the wall. Oxidative stress, meaning reactive oxygen species, are generating the oxidized LDL that the immune cells in the arterial wall ingest and turn into foam cells. And chronic inflammation, meaning the immune response to this process is sustaining and amplifying the cycle rather than resolving it. A 4th condition, reduced nitric oxide availability, connects all 3. Nitric oxide produced by the healthy endothelium suppresses the inflammation, reduces the oxidative stress in the vessel wall, maintains the barrier integrity of the endothelial lining, and promotes the smooth muscle relaxation that keeps the vessel widely patent. When nitric oxide production falls, all 3 conditions for plaque development become more permissive simultaneously. This is why the approach to arterial health that focuses only on lowering LDL cholesterol is addressing one input into a multivariable system. LDL is necessary for plaque to form, but LDL that circulates in a well-protected vascular environment where the endothelium is intact, nitric oxide is adequate, and oxidative stress is low, does not readily enter the arterial wall and does not readily become the oxidized form that macrophages ingest. The same LDL level in a vascular environment of chronic endothelial dysfunction, oxidative stress, and inadequate nitric oxide behaves entirely differently. The cholesterol level tells you how much potential plaque substrate is available. It does not tell you how permissive the arterial environment is for that substrate to be used. The compounds in the morning drink target this picture from multiple angles. Beetroot juice drives nitric oxide through the dietary nitrate pathway that bypasses the age-impaired ENOS enzyme. Ginger reduces the inflammatory signaling in the arterial wall. Garlic supports endothelial nitric oxide synthase activity, reduces LDL oxidation susceptibility, and carries mild antiplatelet effects. Lemon juice provides vitamin C that protects the nitric oxide produced by ENOS from oxidative destruction. And apple cider vinegar addresses the metabolic dimension, blood glucose regulation, and the insulin resistance that drives the endothelial dysfunction underlying the entire process. Together, these 5 compounds address 5 of the most important modifiable inputs into arterial health, and taking them together in the morning, before the first meal of the day, in the window when blood pressure and cortisol are at their morning peak and the cardiovascular system is at its most vulnerable, is the timing strategy with the most biological rationale. The synergy between these ingredients deserves specific mention because it is not simply the sum of 5 independent effects. The dietary nitrate from beetroot produces nitric oxide that requires the oxidative environment to be managed by vitamin C, and the anti-inflammatory compounds to avoid being immediately inactivated. The allicin from garlic supports the ENOS pathway, that is itself dependent on BH4 preserved by vitamin C. The glucose modulation from apple cider vinegar reduces the postprandial insulin spike that drives endothelial dysfunction, which would otherwise blunt the response to the nitric oxide being produced. And the anti-inflammatory gingerols reduce the cytokine, signaling that promotes the foam cell formation in the arterial wall that makes the environment less receptive to the protective signals the other compounds are generating. Each ingredient is supporting the effectiveness of the others in a way that makes the combination more useful than any single component taken alone. The first ingredient is 200 milliliters of unsweetened beetroot juice, which delivers approximately 300 to 400 milligrams of inorganic nitrate, the compound whose conversion to nitric oxide through the oral bacterial pathway produces the vascular effects we have discussed in detail in previous videos on this channel. The evidence for dietary nitrate from beetroot and its blood pressure and blood flow effects is, as I said in those earlier videos, among the strongest in nutritional cardiovascular science. The specific study I want to add in this context is one that is specifically relevant to plaque stability. A study published in the Proceedings of the National Academy of Sciences found that dietary nitrate supplementation reduced the infiltration of macrophages, the immune cells that become the foam cells in arterial plaques, into the arterial wall in animal models of atherosclerosis, and reduced the inflammatory signaling within existing plaques in a way associated with greater plaque stability. Stable plaques are less likely to rupture. Unstable, inflamed plaques are the ones whose rupture triggers the acute blood clots that produce most heart attacks and strokes. The morning timing is specifically beneficial for beetroot juice because it is the morning surge hours when arterial pressure is highest, platelet aggregability is greatest, and any support for vasodilation and nitric oxide availability has its most protective effect. The nitric oxide produced from dietary nitrate peaks approximately 60 to 90 minutes after consumption, which aligns with the peak cardiovascular vulnerability window if the drink is taken approximately 30 minutes before or at the time of normal waking activity. One practical note, the bacterial conversion of nitrate to nitrite in the mouth is inhibited by antibacterial mouthwash. If you use mouthwash, use it at a time other than immediately before or after the morning drink, or consider switching to a non-antibacterial option for the morning routine. Type in the comments right now whether you have already been using beetroot juice as part of your morning routine, and whether you have noticed any effect on your energy, exercise tolerance, or blood pressure readings. The real-world experience of the people watching this video is something I want to hear. The second ingredient is 5 grams, approximately 1 level teaspoon, of freshly grated ginger root, and its role in the morning drink operates primarily through anti-inflammatory pathways that are directly relevant to arterial plaque dynamics. Gingerols and shogels, the primary bioactive compounds in ginger, inhibit the production of prostaglandins and leukotrienes through inhibition of cyclooxygenase and lipoxygenase enzymes, the same enzymatic pathways targeted by NSAIDs. Unlike NSAIDs, however, ginger does not significantly inhibit the prostacyclin that protects the gastric mucosa, and at the doses used in the morning drink, It does not carry the sodium-retaining renal effects of NSAID use that we discussed in the medications and blood pressure videos. In the context of arterial health specifically, a study published in the American Journal of Clinical Nutrition found that ginger supplementation in adults with metabolic syndrome reduced the blood levels of several inflammatory markers, including CRP, interleukin-6, and tumor necrosis factor alpha, all of which are directly involved in the inflammatory phase of plaque development. The study used daily ginger doses comparable to what the morning drink provides. Ginger also has documented effects on platelet aggregation, specifically inhibiting thromboxane synthesis in a way that reduces the platelet clumping tendency. This mild antiplatelet effect is beneficial for most adults over 60, where elevated platelet aggregability contributes to the morning cardiovascular risk window. But it is the reason people on anticoagulant therapy should specifically discuss this ingredient with their prescribing physician before adding it regularly. Fresh grated ginger produces more bioavailable gingerols and shogales than dried ginger powder. The 5-gram amount is a practical daily dose that delivers clinical benefit without the gastrointestinal discomfort that higher amounts can produce in some people. Grating the ginger fresh each morning ensures maximum compound activity. There is an additional benefit of ginger in the morning drink context that is specifically relevant to the post-meal cardiovascular risk discussed in previous videos on this channel. Ginger has been shown to slow gastric emptying slightly, which reduces the rate of glucose entry into the bloodstream following the first meal of the day. For adults managing their post-meal blood glucose, the ginger in the morning drink is working alongside the apple cider vinegar through a complementary mechanism to blunt the first postprandial glucose spike of the day. The two compounds together produce a greater reduction in the morning glucose response than either ingredient alone in most adults. The third ingredient is 1.5 grams of freshly minced raw garlic, approximately half a clove, and the timing of its preparation matters specifically for its primary bioactive compound. Allicin, the sulfur compound responsible for most of garlic's cardiovascular effects, is not present in intact garlic cloves. It is produced enzymatically when garlic cells are physically disrupted, when the enzyme alliinase contacts the precursor compound alliin. This conversion takes approximately 10 minutes after mincing or crushing, and the allicin produced is unstable and begins to degrade within 30 to 60 minutes of its formation. This means that garlic minced just before consumption, as called for in the morning drink, provides substantially more active allicin than pre-minced garlic from a jar, roasted garlic that has been heat-treated, or garlic added to cooking without a resting period after mincing. The specific preparation instruction of freshly minced, used immediately, is not culinary preference. It is the preparation method that preserves the bioactive compound the cardiovascular evidence is built on. The cardiovascular effects of allicin are documented across multiple mechanisms. A meta-analysis published in the Journal of Nutrition, examining 14 randomized trials, found that garlic supplementation produced meaningful reductions in LDL cholesterol, modest reductions in systolic blood pressure, and improvements in endothelial function as measured by flow-mediated dilation. The blood pressure effect appears to be mediated partly through hydrogen sulfide production from allicin metabolism, which activates KATP channels in vascular smooth muscle to produce relaxation. Garlic also reduces the susceptibility of LDL particles to oxidative modification, which is the step that makes circulating LDL capable of initiating the plaque-forming immune response in the arterial wall. Allicin and its metabolites are directly antioxidant and reduce the oxidative environment in which LDL oxidation occurs. At 1.5 grams daily, which is the dose the morning drink provides, garlic is well within the range studied in clinical trials and is unlikely to produce significant gastrointestinal discomfort in most adults when taken with the other components of the drink, rather than on a completely empty stomach. And share this video right now with one person in your life over 60 who has been told their cholesterol is under control, but who has never been given the specific framework for the other factors: inflammation, oxidative stress, and nitric oxide availability that determine their actual arterial risk. You may be handing them the conversation that completes the picture. And if you are not yet subscribed to this channel, tap that button now and ring the bell. I want to tell you about Charles, 64 years old, retired teacher from Edinburgh, Scotland. He had been managed for hypertension for 9 years, and his cholesterol was well controlled on a statin. He considered his cardiovascular risk to be managed. At his annual review, his blood pressure was 141/86, slightly above target despite his medication. His CRP was 2.8 in the mildly elevated range. He had no symptoms. When he came to me, I discussed the full vascular picture beyond his cholesterol number. We identified the 3 modifiable elements that his current management was not addressing: the morning blood pressure that consistently ran above target in the first hour of the day, the chronic mild inflammation reflected in his CRP, and his low fruit and vegetable intake, which meant his dietary nitrate was minimal, and his antioxidant intake was inadequate. We introduced the morning drink protocol, alongside the dietary and lifestyle changes appropriate to his overall picture. At 12 weeks, his morning blood pressure average had fallen by 8 systolic points. His CRP had reduced from 2.8 to 1.4. He had not changed his medications, he told me. I thought my numbers meant my heart was protected. I told him, your cholesterol is protected. Your arteries need more than that, and the morning drink is one of the ways we are providing it. The 4th ingredient is 30 milliliters of freshly squeezed lemon juice, and its primary function in the morning drink is to protect the nitric oxide produced by the other components from the oxidative destruction that would otherwise prevent it from reaching the smooth muscle receptors where it produces vasodilation. Vitamin C, present in lemon juice at approximately 15 to 20 milligrams per 30 milliliter serving, is a water-soluble antioxidant that is rapidly distributed into the plasma following absorption. In the endothelial cell and the smooth muscle cell, ascorbate acts as a direct electron donor to regenerate the BH4 cofactor that is required for ENOS to function in its nitric oxide-producing form, rather than its superoxide-producing uncoupled form. BH4 oxidation is one of the primary mechanisms of endothelial dysfunction in the presence of oxidative stress, and vitamin C supplementation has been shown in multiple studies to partially restore endothelial function by preserving BH4 availability. Lemon juice also provides hesperidin, a flavonoid we discussed in the circulation drinks video, that has been independently shown to improve endothelial function and reduce blood pressure through nitric oxide pathway activation. The combination of vitamin C and hesperidin in fresh lemon juice provides both an antioxidant protective function and a direct ENOS activating function that make it a complementary rather than redundant addition to the beetroot-derived dietary nitrate already in the drink. Fresh lemon juice is specifically more effective than bottled lemon juice because the flavonoid content and the vitamin C are better preserved. A half lemon squeezed fresh each morning provides the 30 milliliter dose with the full compound activity intact. If you are not yet subscribed to this channel, tap that subscribe button now and ring the bell, because every week I come here with exactly this level of specific, mechanistically grounded information about the compounds in your kitchen and what they are doing to your vascular biology. The 5th ingredient is 15 milliliters of unfiltered apple cider vinegar, 1 tablespoon, and its inclusion addresses a dimension of arterial health that the other ingredients do not directly target: the metabolic environment of insulin resistance that drives endothelial dysfunction through the insulin-sodium pathway we discussed in detail in our blood pressure video. Acetic acid, the primary bioactive in apple cider vinegar, inhibits alpha-glucosidase, the intestinal enzyme responsible for cleaving the glycosidic bonds of complex carbohydrates into absorbable glucose. By partially inhibiting this enzyme at the time of carbohydrate ingestion, acetic acid slows the rate of glucose entry into the bloodstream, reduces the postprandial glucose spike, and consequently reduces the insulin response. Over time, with consistent daily use, this contributes to the improvement in insulin sensitivity that reduces the chronic hyperinsulinemia, driving renal sodium retention and endothelial dysfunction. A randomized trial published in the journal Diabetes Care found that consuming apple cider vinegar with a high glycemic meal reduced postprandial glucose by approximately 20% and postprandial insulin by approximately 34%. In the context of the morning drink taken approximately 20 minutes before breakfast, the acetic acid is present in the digestive system when the first meal arrives, producing exactly this glucose-modulating effect on the first and often largest postprandial glucose event of the day. Unfiltered apple cider vinegar, the variety that contains the mother, the bacterial culture that produces the fermented product, is specifically preferred over filtered because it retains the polyphenol content and the probiotic potential that filtered versions have removed. The 15 milliliter dose is the amount studied in most clinical trials and is below the level that produces significant tooth enamel or esophageal irritation when diluted in the drink rather than consumed neat. The optional additions of a quarter teaspoon of turmeric and a small pinch of black pepper add curcumin, whose anti-inflammatory and endothelial protective properties are well documented, in the form of black pepper's piperine, which increases curcumin bioavailability approximately 20-fold by inhibiting the glucuronidation that otherwise rapidly removes curcumin from circulation. Without the black pepper, most dietary curcumin from turmeric is absorbed poorly. With it, the dose in a morning drink provides clinically relevant curcumin exposure. Here is the complete preparation and protocol for the morning arterial support drink. Ingredients and quantities: 200 milliliters of unsweetened beetroot juice, 5 grams of freshly grated ginger, approximately 1 level teaspoon, 1.5 grams of freshly minced raw garlic, approximately half a small clove, allowed to rest for 10 minutes after mincing before use, 30 milliliters of freshly squeezed lemon juice from approximately half a lemon, and 15 milliliters of unfiltered apple cider vinegar. If tolerated, add a quarter teaspoon of ground turmeric with a small pinch of black pepper. Combine all ingredients, stir well, and consume on an empty stomach approximately 20 minutes before the first meal. Follow immediately with a full glass of water to dilute any residual acid in the esophagus from the apple cider vinegar and lemon juice. The preparation takes 2 to 3 minutes if ginger and garlic are prepared fresh each morning, or slightly less if ginger is grated in a small batch at the start of the week and stored refrigerated. The garlic must be prepared fresh because allicin degrades within an hour of mincing. Important safety notes: do not take this drink undiluted from the glass without following immediately with water. The combined acidity of lemon juice and apple cider vinegar, while not harmful to tissue, can cause erosion of tooth enamel over time if it sits in the mouth. Rinse or follow with water immediately. For adults on warfarin or any anticoagulant, both garlic and ginger have mild antiplatelet effects. At the doses in this drink, the interaction is unlikely to be clinically significant for most people, but the effect is real, and your INR or equivalent anticoagulant monitoring should reflect this addition to your regimen. Discuss with your prescribing physician before starting. For adults with esophageal or gastric disease, the acidity of the lemon juice and apple cider vinegar may provoke symptoms in those with active reflux disease or gastric ulcers. Begin with half doses and assess tolerance before increasing. The drink works most effectively as a consistent daily practice, rather than an occasional supplement. The vascular adaptations produced by regular dietary nitrate, reduced oxidative stress, and improved insulin sensitivity accumulate over weeks and months rather than hours and days. A 7-day trial is a starting point for noticing early effects, particularly on morning blood pressure, which often shows measurable improvement within 1 to 2 weeks of consistent beetroot juice consumption in adults with elevated baseline blood pressure. The sustained benefit requires sustained practice. A useful way to track the effect of the morning drink on your specific vascular response is to measure your blood pressure at the same time each morning, in the first 15 minutes after waking and before any activity or caffeine, across the 2 weeks before you begin the drink and the 2 weeks after. This morning blood pressure reading in the first quarter hour of the day captures the cortisol surge and the highest pressure period of the daily cycle. A meaningful reduction in this morning reading over 2 to 4 weeks of consistent practice is a direct measure of the nitric oxide and anti-inflammatory benefit the drink is producing in the window that matters most for cardiovascular event risk. 4 things to carry away from this video. First, arterial health depends on more than cholesterol numbers. The endothelial function, the nitric oxide availability, the inflammatory environment in the vessel wall, and the metabolic condition of insulin resistance are all independently important determinants of plaque development and plaque stability. None of them is captured by a cholesterol panel. Second, the 5 ingredients in the morning drink each target a specific and documented pathway in arterial health. Beetroot juice for dietary nitrate and nitric oxide production, ginger for anti-inflammatory platelet and cytokine modulation, garlic for endothelial nitric oxide synthase activation and LDL oxidation reduction, lemon juice for vitamin C-mediated BH4 preservation, and hesperidin endothelial support, and apple cider vinegar for insulin sensitivity and postprandial glucose modulation. Each one is grounded in clinical evidence at its specific dose. Third, the morning timing of the drink aligns with the cardiovascular vulnerability peak of the early morning hours, providing nitric oxide and anti-inflammatory support in the window, when blood pressure, platelet aggregability, and cortisol are at their daily maximum. This is not arbitrary timing. It is the window where the intervention has its most protective physiological effect. Fourth, this drink supports vascular health. It does not replace evidence-based cardiovascular medication in adults for whom that medication is indicated. It does not substitute for medical evaluation. It is an evidence-based nutritional input into specific vascular pathways that most adults over 60 are not providing consistently from their diet alone. Your arteries are running continuously. They are subject to the mechanical, oxidative, inflammatory, and metabolic conditions of your body every minute of every day. Providing them with daily nutritional support for the specific biological processes that maintain their function and resist the progression of plaque is not alternative medicine. It is applied physiology, grounded in the same mechanisms that pharmaceutical cardiovascular research is built on. The difference is that it begins in the kitchen, takes 3 minutes, and costs a fraction of a prescription. Share this video with one person in your life over 60 whose cardiovascular risk management has focused entirely on cholesterol and who has never been introduced to the vascular health framework beyond that single marker. And subscribe to this channel because every week I come here with one purpose: to give you the specific, evidence-grounded information that makes your daily choices genuinely effective for the health outcomes that matter. Aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.